I know it can feel like a misdiagnosis if your doctor tells you your baby is growth restricted and recommending induction at, say, like 38 weeks. Say it's isolated growth restriction and they've been following you, your weekly testing, your NSTs, your BPPs, and your baby's doing great, but still measuring on the smaller side. And then you deliver and your baby has no complications. Like, it's the best case scenario, right? That baby of yours is beautiful, it's healthy, it's not having any problems. Now, here's why it may feel like it's misdiagnosed, because then your baby's born and you don't have like any complications of it. But I wouldn't necessarily say that's being misdiagnosed, right? Here's our problem with growth restriction. We follow growth restriction, like I said in my last video, with ultrasound. That is the best thing we can do to measure how big the baby is. Now, is ultrasound perfect? No. It's not. And in the third trimester, the estimated fetal weight can be off by a significant amount. But ultrasound is the best modality that we have to test for growth restriction. That's why when we see growth restriction, it's not like we're quickly jumping to induction, having this baby and all this stuff. We measure the umbilical artery Dopplers, which we know can be affected in growth restricted babies. We look at the placenta, we look at the anatomy of the baby to see if there's anything else going on. We do a non-stress test to see how the baby is reacting in utero. Is the baby stressed out? Are there any warning signs that the baby is giving us? So we're looking at the amniotic fluid, right? Amniotic fluid can play a lot into growth restricted babies as well. Honestly, the best case scenario is that we end up with an induction and then your baby has no consequences, right? Like, we did all of the right things to the best of our ability, to the best of the toolbox that we can use, that we have in front of us as OBGYNs. And medicine is just not perfect. While that growth ultrasound may be off, you're still going to catch those babies that are truly growth restrictions and need additional help, and that their survival is going to be best if we induce or get delivered early. Does that make sense? It's hard. We're doing the best we can with the resources that we have, and that's why I'm a huge advocate for always presenting all information to patients, and the patient decides, right? I present risks, benefits, recommendations from my experience, from my 12 years of schooling, and paint different scenarios of what would happen, and you as the patient get to decide. That's what it means to be a doctor. I know not all doctors practice like this. I'm well aware of that. But the good ones, we're out there, I promise you. And we just want to love on patients and help patients. At least that's what I want to do.